Hey there everyone, welcome to my channel, Nurse ME here. I have picked some questions to put your nursing knowledge to the test. If you have any questions, do not hesitate to post them in the comments section and I will respond to you. I passed the NCLEX on the first try and I would love for each one of you to pass as well. Now before we jump into the questions, make sure you hit that subscribe button and give this video a like. And do not forget to drop a comment below sharing how many questions you got right.
Which is the best action for the practical nurse to take when a client receiving a continuous tube feeding develops diarrhea? A. Increase the feeding rate. B. Decrease the feeding rate. C. Stop the feeding immediately. D. Dilute the formula with water. The correct answer is B. Decrease the feeding rate. Rationale: decreasing the feeding rate can help reduce the risk of diarrhea and allow better absorption. What is the primary purpose of the Glasgow Coma Scale? A. To assess the level of pain. B. To evaluate respiratory function. C. To measure level of consciousness. D. To monitor fluid balance. The correct answer is C. To measure level of consciousness. Rationale: the Glasgow Coma Scale is used to assess a person's level of consciousness, particularly after a head injury. When caring for a client with a new colostomy, what is an essential nursing intervention? A. Advise a high-fiber diet immediately postoperatively. B. Teach how to measure and cut the stoma bag opening. C. Apply sterile dressings to the stoma. D. Limit fluid intake to reduce output. The correct answer is B. Teach how to measure and cut the stoma bag opening. Rationale: correctly measuring and cutting the stoma bag opening is crucial to ensure proper fit and prevent skin irritation. Which of the following actions should a practical nurse take to reduce the risk of a urinary tract infection, UTI, in a catheterized client? A. Disconnect the catheter from the drainage bag periodically. B. Irrigate the catheter every 8 hours. C. Ensure the drainage bag is kept below bladder level. D. Apply antiseptic ointment to the catheter insertion site. The correct answer is C. Ensure the drainage bag is kept below bladder level. Rationale: keeping the drainage bag below bladder level prevents backflow of urine, reducing the risk of infection. What is the most appropriate action for a practical nurse when a client with COPD becomes short of breath during an activity? A. Encourage continued activity to build endurance. B. Administer a prescribed bronchodilator. C. Provide oxygen at 6 liters per minute. D. Have the client sit and perform pursed lip breathing. The correct answer is D. Have the client sit and perform pursed lip breathing. Rationale: pursed lip breathing helps slow down breathing, improve oxygenation, and reduce dyspnea in clients with COPD. A client receiving heparin for DVT prophylaxis has a partial thromboplastin time, PTT, significantly above the therapeutic range. What should the practical nurse do first? A. Continue to monitor the PTT. B. Increase the heparin dose. C. Administer protamine sulfate as prescribed. D. Apply warm compresses to the injection site. The correct answer is C. Administer protamine sulfate as prescribed. Rationale: protamine sulfate is the antidote for heparin overdose and should be administered to reverse excessive anticoagulation. Which intervention is most appropriate for a client experiencing constipation? A. Encourage a diet high in cheese and eggs. B. Advise the use of a bedpan for bowel movements. C. Increase fiber intake and encourage ambulation. D. Limit fluid intake to decrease stool frequency. The correct answer is C. Increase fiber intake and encourage ambulation. Rationale: high-fiber foods and physical activity can help stimulate bowel movements and alleviate constipation. What is the best method for the practical nurse to confirm the placement of a nasogastric tube before administering a feeding? A. Auscultate for air injected into the tube. B. Check the client's vital signs. C. Verify the pH of aspirated contents. D. Ask the client if they feel the tube in their stomach. The correct answer is C. Verify the pH of aspirated contents. Rationale: checking the pH of the aspirate helps confirm the tube is in the stomach by identifying the acidic environment. What is the priority nursing intervention for a client who has just returned from surgery and is experiencing hypotension? A. Elevate the head of the bed. B. Increase the rate of
IV.
fluids as prescribed. C. Administer oral fluids immediately. D. Apply a heating pad to the lower extremities. The correct answer is B. Increase the rate of
IV.
fluids as prescribed. Rationale: increasing
IV.
fluids helps restore blood volume and improve blood pressure in postoperative clients. Which symptom is most indicative of a transfusion reaction? A. Bradycardia. B. Hypertension. C. Fever and chills. D. Polyuria. The correct answer is C. Fever and chills. Rationale: fever and chills are common signs of a transfusion reaction and require immediate intervention.
Thank you very much.